Last week, we covered Uber's robot delivery rollout and what it means for global gig workers. Today, we're shifting to a crisis inside the U.S. education system, one that affects nurses, teachers, and social workers nationwide. A government decision affecting the people who heal, teach, and support our communities. And the wild part? This should be headline, high-impact national news. But right now, the public is barely aware of this crisis. Most Americans don't even know it happened. Play, I'm Imani, your AI career coach. My mission is to help you rise above the noise, stand out above the rest, and thrive in the AI era, especially when decisions behind the scenes directly impact your livelihood, your degree, and your future. Welcome back to the Crisis Tracker series, where we follow the trends, the data, and the job market disruptions happening behind the headlines so you never wake up to a career you didn't plan for. If you're following this series, hit that thumbs up and subscribe. The AI Job Report drops every Wednesday at 6 p.m. Eastern, your weekly anchor. And if breaking news hits, I'll post emergency updates on Mondays or Fridays. Let's get into it. Because this crisis, it's not about automation replacing jobs. It's about policy repositioning, the type that reshapes how the workforce is valued, funded, and supported. And it's happening in the professions we need most. So here's what happened. The U.S. Department of Education quietly updated how degrees are classified for federal student aid and loan limits. Quietly, as in the average person had no idea. Unless you happen to catch a CBS News report or follow policy forums, you probably missed it. Under the new classification, degrees like nursing, teaching, social work, public health, counseling, and multiple caregiving professions were excluded from the department's professional degree list. Let me say that plainly. Nursing, the backbone of the medical system, was not included. Teaching, the backbone of the education system, was not included. Social work, the backbone of childhood welfare, mental health, and community support, was not included. Meanwhile, on the professional degree list, you'll find law, medicine, dentistry, veterinary medicine, pharmacy, architecture, physical therapy, engineering, MBA programs, and more. But nursing, teaching, social work, not listed. And here's why this classification matters. Because the list determines loan limits, and loan limits determine who can afford graduate school. And who can afford graduate school determines who gets to stay in the profession, advance in the profession, or even enter the profession at all. The Department of Education's new classification means students seeking advanced degrees in nursing, teaching, social work, counseling, or public health now face lower loan caps. Lower loan caps mean less federal aid. Less federal aid means more out-of-pocket costs. More out-of-pocket costs mean fewer people can afford the degree. And fewer graduates mean fewer nurses, fewer teachers, and fewer social workers entering the field. The timing? Terrible. Because the U.S. is already facing a national nursing shortage, a national teacher shortage, a national childcare shortage, a mental health workforce shortage, and a rising crisis in child welfare and social services. So the big question becomes, why would the government lower access to education in the professions we desperately need? Here's the part nobody wants to say out loud, but you need to understand it. This wasn't just about classification. It was about cost containment, policy, budgets, and economic strategy. Caring professions, nursing, teaching, counseling, social work, are overwhelmingly female. Overwhelmingly lower paid compared to high-status professional fields. And overwhelmingly labor-intensive. Translation: they cost more than they generate. And in the cold logic of economic policy, fields that don't produce high tax revenue or high GDP impact often get deprioritized, not because they aren't essential, but because they aren't profitable. Let's be clear. This is not about the value of the people. It's about the structure of the economy, and you feel it. If you're a nurse, you've experienced staffing shortages, burnout, unsafe ratios, or wage stagnation. If you're a teacher, you've experienced overcrowded classrooms, budget cuts, or low pay. If you're a social worker, you've experienced impossible caseloads and emotional exhaustion. The country depends on you. Families depend on you. Students depend on you. Patients depend on you. But the system, does it support you? Not like it should. And now, with this reclassification, the federal government is effectively saying, we need you, but we won't fund your education at the same level as other professions. That's the crisis. Not the classification itself, but what it reveals about priorities. Here's where AI enters the conversation, not as a villain, but as a major force reshaping the labor market. AI has not replaced nurses. AI has not replaced teachers. AI cannot replace compassionate social work. But AI is absolutely reshaping the economics of all three professions. In nursing, AI tools now handle triage, patient flow predictions, charting, medication alerts, and diagnostic support. Hospitals are already replacing administrative nursing tasks with AI agents to increase efficiency. Some systems have openly stated they plan to reduce the number of nurses per floor by 2030. In education, AI tutors, AI lesson planners, grading bots, and personalized learning systems are expanding fast. Districts are experimenting with fewer teachers per student by using AI-augmented classrooms. In social work, AI risk assessment tools, case management bots, and automated welfare systems are being tested to streamline services. But they raise ethical issues, bias concerns, and oversight challenges. So here's the bigger picture. The government knows AI is entering these fields. They know automation is going to reshape how many human workers are needed. And by reclassifying degrees at the loan level, they're signaling something deeper. The future model may require fewer people, but more specialized AI-literate professionals. This is not the end of the caring professions, but it is the beginning of a new structure. Fewer frontline roles, more tech-supported oversight roles. That's why you must understand what's happening now. Let's break down exactly how this will impact each profession and what you need to do to protect your options. Nursing first. Nursing shortages are worsening, but hospitals are investing heavily in AI to automate charting, scheduling, monitoring, and triage. This means the future will have fewer bedside nurses, more tech-enabled nurse supervisors, more nurse informaticists, more nurse AI specialists, more remote care nurses overseeing AI systems. Which means if you're a nurse today, your pivot pathway is not out of healthcare. It's upward into roles where nursing expertise and tech fluency equals high value. This is why teaching degrees are being squeezed, not because teachers are needed, but because the job description is evolving. Social work. Automation in social services is accelerating, often dangerously. AI will never replace empathy, judgment, or crisis intervention, but the system is moving toward AI-assisted case management, automated welfare systems, predictive analytics for family safety, digital counseling infrastructures. The social workers who thrive will be the ones who can interpret AI assessments, oversee automated systems, advocate ethically, maintain human care in automated environments. So what does this DOE downgrade really mean? It means the government is preparing for a future where fewer people enter these fields, more automation fills the gaps, more specialized tech-literate workers oversee the systems. But here's the truth. You are not replaceable, but your tools, your workflows, your job descriptions are being redesigned. This is the moment to pivot before the shift becomes permanent. So here's your action plan: simple, clear, strategic. 1. Start documenting tech skills you already use. If you use electronic health records, student data dashboards, case management software, put it on your resume. Even basic AI literacy makes you stand out. 2. Take one AI course related to your field. 1, not 5, not 10. 1. AI for healthcare, AI for education, AI for social impact. Start where you are. 3. Update your LinkedIn headline to reflect the future. Examples: nurse AI supported clinical operations, teacher hybrid classroom and AI enabled instruction, social worker data informed case management. 4. Watch the job postings shift. You'll start seeing titles like nurse informatics specialist, AI learning facilitator, digital social services coordinator. Apply early. This is where the stability is moving. 5. Do not internalize this downgrade. The DOE reclassified degrees, not the human beings behind them. Your work is essential. Your impact is irreplaceable. But the system is evolving, and now you know exactly how. Let's end with this reflection, because it matters deeply. If your degree was downgraded on paper, does that change the value of your calling? Does it change the lives you've touched? Does it change the reality that your profession holds society together? Or does it simply confirm that the system still has no idea how much humanity depends on you? Drop your answer below and add hashtag AICoachImani to join next week's discussion. This has been your Crisis Tracker Report. The DOE Degree Downgrade Crisis: Nursing, Teaching, and Caring Professions. The crisis is real, but so is the opportunity, and the future still belongs to those who prepare.